Hello, and welcome to our coding snapshot on the genital urinary system. Let's go ahead and get started. The genital urinary system is a Chapter 14 Pacific Coding Guidelines, and this section starts with N00 and it goes through N99. Let's take a look at Coding Guideline 1A, which is stages of chronic kidney disease, which is also known as CKD. ITN classifies CKD based on its severity, and there are 5 stages. You have code N18.1, which is stage 1, N18.2 is stage 2, which is considered mild, N18.3 is stage 3, which is considered moderate. You have N18.4, which is stage 4, which is considered severe. Then you have stage 5, which is N18.5. And if I got here to see the exclude notes 1, I want you to go to your tabular and I want you to go to N18.5. And what you're going to see there is an exclude notes 1. So what I want you to do is note that a patient with CKD stage 5 documented as requiring chronic dialysis, this is to be coded with code N18.6, that's your end-stage renal disease, and Z99.2, which is dependence on dialysis. So again, look at N18.5, exclude notes 1, and that's indicating to you the patient with CKD stage 5, which also requires chronic dialysis, is to be coded to N18.6 and Z99.2 and not N18.5. And then the last stage there we've got is N18.6. The patient is in total need of a kidney transplant. This is considered end-stage renal disease, and while they're awaiting a kidney transplant, they must be on some form of dialysis to live. In the case that the physician documents both CKD and end-stage renal disease, you are to assign N18.6 only, so you don't need both codes. So again, the end stage is going to take precedence, and you're going to assign N18.6. Coding Guideline 2, CKD and kidney transplant status. Patients who've had a kidney transplant, these patients can still have some form of CKD, so the kidney transplant is not going to totally cure them entirely of their CKD, so keep that in mind. Also keep in mind that the presence of CKD alone does not constitute a transplant complication. So just because it's documented that the patient has CKD and they've had a kidney transplant in the past, that does not mean that their kidney is being rejected. So keep that in mind. You have to have physician documentation. You're going to assign a code from category N18 for patients with CKD and a code for Z94.0 for kidney transplant status. If you are unsure about whether or not that this is some form of rejection, you need to query the physician. Let's look at this practice example. We've got end-stage renal disease with peritoneal dialysis. So this requires 3 codes. You're going to code N18.6 for the end-stage renal disease, and they are dependent on dialysis, so it's Z99.2. And you're also going to have to code the procedure through PCS, the peritoneal dialysis, which is 3E1M39Z. Let's take a look at our last coding guideline there, which is coding guideline 3, CKD with other diseases. Patients with CKD often have other serious conditions. What comes to mind is diabetes and hypertension. So sequencing matters in these cases, and you want to refer to the conventions in your tabular list for sequencing. Let's take a look at this practice example. We have CKD stage 4 due to hypertension and type 1 diabetes mellitus. This requires 3 codes. You've got your I-12.9, which is a hypertensive CKD, And you've got E10.22, that is your diabetes, and then you have to code the stage, which is stage 4, N18.4. I want you to note the instructions when you look at N18.4. It says see the code first instructions in the tabular list. So again, look at category N18, and what you'll see there in red, it's indicating to the coder that they need to code first any associated conditions that you see there. It tells you to code first any associated diabetic CKD, any hypertensive CKD, and also it tells you to use any additional code to identify kidney transplant status. So again, this is why you always consult your tabular list. I hope you have found this coding snapshot on the GU system helpful.